discussions on topics affecting Hawaii's youth, ohana, and community.
Aloha mai kako! Welcome again to another episode of Kukakuka, where we get to talk story with our beautiful, wonderful community organizations who are providing services across our state to help serve our youth and our families and our community. So once again, I'm Venus Kauiokaveku Rossetti Medeiros, CEO of Hale Kipa, and we're here today to talk about the impact of domestic violence here in Hawaii that's impacting our youth and our communities. And I have three beautiful guests today. We have Ella Mojica. Ella Mojica, who is the Vice President of Community Services with the Domestic Violence Action Center. We also have Angie Mercado, who is Executive Director for the State Hawaii State Hawaii against domestic violence. Something like that, yeah? Yes. Coalition against domestic violence. There you go. And then I also have here Dolly Tatofi, who is here representing Pohana Onawahine, and she is the Director of Culture and Operations. So mahalo women, how are you?
Aloha.
Our wahine. Okay. I want to really start off talking to Ella. So Ella is with the Domestic Violence Action Center, and Ella, you guys have been around for quite some time, right?
32 years.
32 years. Now, are you guys the very first domestic violence organization
here in
Hawaii?
You know, I couldn't tell you that for sure. I know we are one of the largest domestic violence agencies in Hawaii.
Okay, well, real quick, let's fact check.
Fact check.
When did you start?
So actually, the Hawaii State Coalition Against Domestic Violence started as a Hawaii Community Family Violence organization, and it founded as a community grassroots organization in 1984.
Okay.
But we weren't providing direct services. So we were a grassroots organization, started as what eventually became the coalition, which still does not provide direct services, but what we do is that we do systems advocacy, we do public policy, we do training and technical assistance for member organizations like Domestic Violence Action Center.
Okay, so you were first, and then you guys came along.
Well, the Domestic Violence Action Center was originally the Domestic Violence Clearinghouse and Legal Hotline.
So how come you guys keep changing your names?
This was back in 1970 something.
Oh, okay.
And it started off with two people on their lunch break answering calls. And so what they found right away was that the people who were calling in for legal information or advice, they had so much other social needs that they met. Then later on, it became the Domestic Violence Action Center.
Oh, okay. Yeah. And I know your long time Executive Director Jess retired,
yes,
right?
Nancy Creedman just retired in June. And so our new CEO, Monique Ibarra, is on. So we're really excited about that.
Awesome. Yeah. And Monique is a Maui girl.
She's a Maui girl,
yes. Yes. So welcome to Monique. And Monique did say, hey, I'm kind of new on the job, so please speak to Ella on the show. So maybe you can share with us, what are you guys working on right now? What are some trends that you're seeing around domestic violence here in Hawaii?
Yeah, so as you know, I mean, October we just kind of ended Domestic Violence Awareness Month, right? And so we had a lot of education and outreach going on, and we think that education and awareness is the first step to helping us move the needle in the right direction, because as we know, and Angie and Dolly can speak to that too, domestic violence is prevalent in our community. So we have so much outreach and training going on. I think in the last quarter, our Teen Alert program, better known as TAP 808, they served about, or they outreached to about 900 youth So
Wow.
yeah, we're so proud of that. And then, you know, we have our advocacy and legal services. And currently we have over 200 active cases that our advocates are working with survivors and their children.
So do you have a legal team?
We do have a legal team. We have, oh gosh, I might get this wrong, but I think we have 5 staff attorneys, 4 paralegals, and then, 5 staff attorneys, 4 paralegals. I might have that wrong. But we do. We have, so they're in court. They're representing survivors on TRO, paternity, divorce, and immigration cases. So.
Wow. So Ella, do you just serve Oahu or is it statewide?
So our advocacy and legal services and our housing programs are here for survivors that are on Oahu, but our helpline, which is, I feel like it's can be looked at as kind of a lifeline to the community. That's statewide, and then our education and training programs are all statewide. So just legal and legal advocacy and housing are just specifically for Oahu.
So when you say housing, do you provide housing for victims of domestic violence? And
yeah, so I want to make sure that I'm very clear about this. We do not have emergency safe shelter. We do provide a permanent supportive housing, and we partner with the United Church of Christ, who has a transitional house, or transition house we call it. And so the survivors that we work with are put into those housing programs.
okay, so great to know, and I love the fact that you guys also use survivors, right? Same as our sex trafficking young people who were here previously. Question: when you have like a woman or a young girl, do you have specific ages that you work with, or what are the ages?
Yes, so I mentioned our Top 808 program, our Teen Alert. And in that program, it's really neat. It's so unique because it doesn't, we call them educator advocates. So they're not just going out into the different schools or the community to educate youth about healthy relationships, but they also provide advocacy. And advocacy for youth looks very different than it does for an adult survivor. And so that program serves youth ages 12 to 21. And then the other advocacy programs are serving adults.
Okay, and now do you also do young boys and men?
We do have, I think that the last time that we checked, we had 2% of our total population that we're serving, or survivors that we're serving, were men. Right now we currently do not have any males on our caseload for our youth program, but yes, we do. That's the short answer, is yes,
Okay.
Of course. We serve anyone who's assessed to be a survivor of intimate partner violence.
Thank you. That's great.
Thank you.
Angie, let us know what's happening in our state coalition right now.
So, as I mentioned before, how we differentiate ourselves, we don't provide direct services, and we are actually one of 56 coalitions in the country. So there's one domestic violence or combined domestic violence sexual assault coalition in each state and territory. So those territories would include Virgin Islands, Puerto Rico, Guam, American Samoa, and CNMI, Northern Mariana Islands. So, those are our sister coalitions out in the oceans, as we call them, and the territories. So we are designated in federal statute under FIPSA by DHHS, Department of Health and Human Services, and we have a very specific role in statute. And we have a membership, and our membership consists of member programs like Domestic Violence Action Center, Parents and Children Together, CFS, and it's statewide. So we have member programs like Women Helping Women in Maui,
Yes.
and YWCA on Kauai. And so our purpose is to serve those programs. And so we do ongoing training. So any issues that they may have that may come up for them, so that if, advanced, any legislation that comes out. So for instance, one of the legislations that came out a couple of years ago was the Gun Violence Protection Order. And as you know, you may or may not know that our domestic violence protection orders also have a prohibition from access to firearms and ammunition if you have a domestic violence protection order against you. So what we did is a technical assistance piece on the differences between those two, and then we did a training on that, so that when an advocate works with a survivor, it's like it helps them be able to navigate what those two types of protection orders are, and helps those advocates with survivors make the best decision for them in that moment of time.
Love that.
Yeah, and so that's the kind of technical assistance that we do. In the last legislative session, for instance, we also do public policy. So we had a very active role in the last legislative session, and we helped advance more and get in statute more training for our domestic violence advocates. We're just finishing that training as well for them in our 35-hour mandatory training. And we're also get involved in a lot of national legislation as well. So we were part of one of 60 other statewide coalitions that got involved in an amicus brief again with the U.S. versus Rahimi, which has to do with it's the Supreme Court. The Supreme Court is hearing a case, and they will decide whether or not it is against the Second Amendment to prohibit someone who has a domestic violence protection order against them, or if they have been convicted of a domestic violence crime, to prohibit them from access to firearms. And tomorrow, Tuesday, November 2nd, is when they're hearing oral arguments. So that's the kind of work that we do on the state, local. November 2nd. November 7th. November 7th.
I was like, okay.
Yeah. So that's the kind of work that we do on the sort of big picture, systemic training TA level.
Got it.
And any calls that our programs have and say, hey, in our shelters, something came up that we haven't dealt with. How do we do this? How can we, how do we do this without being in violation of the federal regs under which we're funded?
Got it.
Yeah.
So both of you sound very busy, your organizations. What's your staff total like?
So right now we have, I believe it's 42 total staff.
Wow.
Yeah. So.
And how about you, Angie?
We're at 5 right now. We're hiring for one more and looking for funding for another couple of other positions.
Now, because you're the state coalition, does the state provide funding for you? Like automatic funding?
No, there's not anything written in statute with general funds. Some other states have been able to do that. I know Texas has that as part of a percentage of the state's budget. But there's some pros and cons, right? So, they can't do certain types of, they can't do other types of work that may be against the, popular.
Yeah,
demand.
like advocacy would be something that would be a little bit challenging, I would say.
Yeah.
Right?
Yeah. But we get there are a couple of state contracts out there that we are eligible for that will support our work on a systemic level, or like prevention or education and training level.
All right.
Yeah.
Thanks, Angie. So Dolly, let's move over to you.
Yeah,
now you have a little different take on the whole domestic violence challenge that's happening here in Hawaii. Can you talk a little bit about Pohana o Nawahine?
Yeah, sure. So it's very similar to what Angie them do at Coalition, but more on the Kanaka Iwi, so the Native Hawaiian perspective. Yeah, so we're also federally funded by OFIPs right now, as they're known now. Yeah. And we've only been funded for about a year now, so we're in year 2 now.
What is OFIP for those people watching and don't know what OFIP is?
I'm gonna fumble, but Office of Family Violence Prevention, Services Act.
Oh, okay, there you
Kalamai, yeah.
So, Dolly, when you say you do kind of the same thing as Angie, but
similar.
From a Native Hawaiian or Kanaka Iwi lens, can you explain a little bit what that means?
Yeah, a lot of the things that Angie said, we do very similar things.
Like training,
technical assistance, the systems change, education, information. So it's macro level work. But from the Native Hawaiian Kanaka Iwi view, we're founded, our foundation is on Hawaiian worldview. So the pilina between, or the relationships between Kanaka people, the Aina, the land, the elements. This is, a kua, so your higher being, that all of these things are foundational. So we say that foundational to what we do is pilina. So connection, with the people. So a lot of the things that we do is with intention, and our intention is through aloha, because we believe that aloha is the pathway to healing, which a lot of our people need, right? So that and pilina go hand in hand pretty much. So, you want me to expand a little bit more?
Well, I'll ask, because I have some questions running through my head. So, if a non-Hawaiian was to come and want to participate in the services that you offer, how would you, so is it open to all, I guess is my question.
Well, we don't really say, no, we cannot help you, It's how can we help you, and how can we actually kind of guide you or direct you in the right way that you're going to get the most need, not most need, but most help, pretty much, So if it comes to us, of course, we're going to say, hey, okay, we're not going to just drop you and, say, no, we cannot,
Right.
It's more about, because there's a lot of we're social workers. We have social workers in our staffing, so.
And how many staff do you have right now? Because you guys are fairly new.
Yeah, grassroots for about 8 years, funded 1 year, maybe about 3-4 years as a nonprofit. So pretty brand new. Yeah. We're the fresh ones around the block. So
now, why did you, or the founders, decide that was something that you would want to pursue, to go in the direction of a Native Hawaiian lens? What was the cause of that?
There's not a lot of programs out there that focus on Native Hawaiians. There might be funding out there, but nobody's applying for them, or no organizations that are Kanaka Iwi by and for by Kanaka Iwi. And so because of that, the services and the, being able to provide services is pretty low. And I mean, if you're living in Hawaii and here, on the continent, with our Native American sisters and brothers, the things that we deal with as natives, so disproportionate, right? Everything is all huli, everything upside down. And most of our people are incarcerated, most of our people are faced with IPV, violence, all you name it, health disparities, right? Those kinds of things.
So Native Hawaiians are at the highest right now being impacted by domestic violence? Is it Native Hawaiians?
In Hawaii.
In Hawaii?
Yeah.
And the biggest difference between our two organizations is that they have national reach. So they're part of a national network of domestic violence resource centers, of which there's a Latino organization, a Black organization, and Indigenous Women's Resource Centers. So we are in Hawaii, and we're the Hawaii State Coalition, the way there is the California Coalition, but they have national reach, and they have, so they're, especially because we know that there are more, and we know that there are more Native Hawaiians living outside of Hawaii than in the state of Hawaii. And so that is also an amazing opportunity that they have for the work that they do.
So we have lots of hana to do.
Yeah.
Yeah. And we've been, continuing to, branch out there as much as we can and trying to understand the need out there as well. Our heart is here, but of course we cannot forget our Kanaka that's overseas,
Absolutely. Now, it sounds like the three organizations work close. You support each other's work. Yeah. Which is great, because I think a lot of times people go, oh, you guys are duplicating services, right? We get it. A lot of people who are working in the youth, field or with families, why are you guys, there's more organizations working in this area. Why don't you guys just come together as one? Would you agree that there's enough work for all of us?
Yes. Yes.
Okay. Right. So but you know what? I tell you, we can roll our eyes and go, oh, yeah. There's lots of
True,
work,
yeah,
but
yeah.
you'd be surprised how many people don't realize, right? How many families are being impacted by domestic violence. And we see a lot of the young people or the children of those households coming to us at Hale Kipa,
Yeah.
right? Which is why they're kind of in the child welfare system because of incidents of domestic violence. So we get it, but not too many of our community does, which is why we have this show, right? Kukakuka is really about educating our community about these needs
Yep.
and how important it is for us to be able to like, hey, if you want to support us, you want to help, we're here. You know, please, we could use some support, right?
Yes. Well, and one of the things that Dolly was saying that I want to, if we can, do some myth busting, is
Go for it.
the important thing that she said was about like services by Kanaka for Kanaka, right? We don't have that here, right? We don't, and especially when it comes to domestic violence services and sexual assault services, which is so interesting because you have that on the continent. And for other communities, and even for Asian communities, but we don't have that here. So there's this like thought that we are so diverse because we have so many cultures here, but when it comes to actual domestic violence services, we don't have a Native Hawaiian domestic violence shelter or Pacific Islander domestic violence shelter, and those specific types of services run by the culture for that culture, because when you do that work from that perspective, I think we would see more people reaching out for help. And this was,
Absolutely.
they all know I'm not here. You may not hear it because they know when I'm off camera how I speak. I'm gonna let it out a little bit because I can code switch. I'm a New Yorker. I'm a New Yorker, Puerto Rican. Okay, your pasteles too. Okay,
yeah,
right, right. Your
pasteles
panin, right. I'm gonna come out with my New Yorker, and right. So, but it was eye opening to have to do a project with doing some Samoan community work, and learning about the Samoan community and what that's like if you are thinking about IPV in that community, and the importance, for instance, of the church, and how that is so important, and that is the center of your life. And when you leave that, you disassociate from all your support system. So how can we, if we're doing mainstream programming, tell someone, go leave to shelter, and then break everything away from how you do it, and break your communal style of living and communal support, right? And then like the shame factor that all of our communities have some sort of we all know we have a level of shame factor in all communities, but what does that look like, and how do we incorporate that into our programming and our understanding and our services to really be able to provide services? And we don't have that on these levels. And
well, now Pohana is in the house, and they're here, and they're starting up to they're getting the word out. And I think the other piece is the missing right, indigenous girls and women. So there's that whole domestic violence, and then there's that other right. People don't realize that there's that other impact that's happening in our communities where our young people go missing, right? Can you talk a little bit about that?
Well, I guess a thought came to mind as you're mentioning that. And if Representative Stacey Eli was the one that actually advocated for the state task force, right, on that particular topic to happen. One of the things that I remember her saying when she was in office, of course, was that our families are not talking. They're not talking with each other. And, we got to get back to Ohana and be able to do this. And, traditionally, right, there's, that's what we used to do all the time. We always used to ho'oponopono all the time, no matter how it was done, whether there was religious foundation to that, or this is just natural to your ohana. Each island, each ohana from different places, wherever you came from, the mountain, the ocean, however, you had a way to always talk about what's going on, because they know if you wasn't pono, you wasn't just within yourself, within your ohana, you cannot align and function with the whole entire system in Hawaii, in your own kaia'ulu. You cannot function in your community. You cannot function in your ahapua'a without doing these things. So every little thing connected to everything else. You know, like it was so important, you know. And so I thought that was pretty impactful when she mentioned, you know, our families are not talking today, you know. But that's what we used to do a long time ago, you know. It's kind of like we missed that way of doing that life, that pathway, right, of just talking and making things right again, you know.
Yeah, because when you think about it, I mean, you had to do face-to-face communication, right? How else could you do it?
Yeah.
They never have telephones, never have cell
Yeah.
phones, they didn't have, you know, texting, right? If you wanted to communicate, you had to, you know, alo to alo, right?
Yeah, and so
Face
that's
to face.
actually what we're finding through the work right now. So we're doing a lot of these papo'olelo sessions in the community. So like conversations in the field, in different communities. Could be Hilo, you know, could be Eva, you know, wherever. We're just doing all these different papo'olelo sessions. Survivors, providers, all kinds of different communities we're talking about right now. And that's actually what we're finding a lot of is they are appreciative of the space to be able to just get this out because they never had a chance to talk about it. Even providers, you would be surprised at the providers we talk with and how much they want to be able to just release these things, but they don't know who to talk to. And so we're finding that creating these spaces more out there in the communities, you know, people are embracing it because they want to get it out, you know. So I thought that was pretty interesting that we're coming across these things, and it's good to know, you know, that some of the things that we're doing are impactful in that way. Yeah.
And I believe Hale Kipa helped to host some of those at our campus in Eva.
Yes, you did.
Some of those talk story sessions. Now I know DVAT also has a kind of Hawaiian focused program, right?
Ho'oikaika ohana.
Yeah, can you share a little bit about that?
Yes, so I loved everything that that Dolly and Angie was saying about, you know, the importance of kind of having programs for people that understand the nuances of a culture, especially when you're dealing with IPV, for example, right?
What is IPV? Can you?
Intimate partner violence.
Okay.
And so, you know, I was sharing with another advocate who's not from here. She said, "You guys always talk about talk story." And I said, you know, I said, you know, you have to understand using talk story as a tool. Because if a Native Hawaiian person came in here and you say, okay, can you tell me the last time you were abused? She's not going to talk to you. First of all, you don't look like her. You don't speak like her. You don't come from where she comes from. You don't understand the nuances of how she's asking for help and how she's receiving, how she'll receive the support, right?
And that's kind of like maha'oi,
Exactly.
right? You know, maha'oi, when you're like nosy, like you don't even know me and you're like wanting to get deep into my life.
Which is
like,
so important
right.
for cultural or programs that, you know, have people who come from the culture, understand the culture, and know, you know, we grow up, right, here, learning from the mo'olelo that our ancestors share, right? And that's how we learn. That's how we learn to interact with people. That's how we learn to be, right? That's how we learn how to respect people, how not to respect people, maybe. And so I wasn't there from the inception of Ho'oikaika Ohana, but I did have the privilege to manage it for about 4 years. And so it really used values, Native Hawaiian values, I guess, ohana, kuleana, you know, kino, all of those things to try to implement the way that we're doing our work, mainstream work, right? And so, it's really when I would meet people in the mainland, they're saying, well, how is ho'oikaika ohana different? And I'm trying to explain to them us using talk story as a tool when I'm trying to assess someone, right? You have these needs assessment, safety, lethality assessment, and the way that we choose to talk story with a person to connect, as like Dolly said, it's so important to make those connections, because if you look like me, and you speak like me, maybe I'm more likely to tell you, because like Angie said, it's associated with shame, with guilt, with, all of that. And so, and maybe in some of our cultures, we don't even have a name for domestic violence, for the child welfare system, for all of that. And so I think it's so important to have programs where people may understand some of the choices that you make, because as we know, many survivors, for many reasons, choose to stay. They don't want to leave. They just want the violence to stop, whether it be religion, culture, anything like that. And so it's so important to have people from who understand, from the community, can understand some of the choices that the survivors that we work with might make. So yeah, Ho'oikaika started off, they formed a hui of culture navigators, survivors, and they created Ho'oikaika. And so that's been around for
Dana
for
actually, our executive director
Dana,
is the one that
she was part of it.
Because she used to work at DVAC, right?
Yes,
yes,
right.
That's
See
right.
all the
Thank
connection.
you, Dolly.
Yes.
Yes. So
Dana's the
it's
one,
beautiful. And a beautiful curriculum was written. So it was a 9-month program. Where we use talk story. We use mo'olelo, and you have the ohana, and we take the values of the lokahi will, and we do it. We're not just reading a book, but we're sharing stories, because you learn by sharing, or and heal. Maybe you can heal by sharing stories or hearing from other people's stories. For example, one of the activities that they do is, kalo is so important to Native Hawaiian people. It's not just a plant, it's not just and so what they do is during, some of the groups that they have, it's mom and the keiki too. So while they're pounding kalo, they're hearing the story of Haloa. And, and then it's just so, there's just so many things coming together. We're not just in a classroom or in an office with me with my clipboard and my paperwork. We're talking story. We're participating in, some of the customs, and, we're implementing that into the work. So I think that's so beautiful. But they're absolutely right. We need programs that are focused just on that, because we're still considered mainstream.
Yeah, right.
So,
That's so important, though, to understand that the pilina is important,
Right.
especially in our community, especially the Kanaka Iwi community, because you kind of just come in and say, hey, let's talk about domestic violence.
Right.
They're going to be like,
Right.
what
What
is
is that?
You have to go, like how you're saying, like if you're going to talk about kalo, you have to go in that way, and then you can bring it, and show them what all the values are that are associated with that don't align with that kind of area, right? So domestic violence. So yeah, in fact, I'm gonna go Job Corps this week, and do the same thing.
See, it's so beautiful,
yeah.
because then, they get to it's not just going in, right, and it's a DV class or parenting class. We're trying to help them maybe discover or re-identify who they are, where they come from. That's meaningful to know. What does my name mean? Where do I come from? Like, where do my ancestors come from? And a lot of the things they start to learn, like, oh, maybe that's why I handle things the way that I handle. Yeah, maybe normalize things because the way that I was brought up. And so it's beautiful. It's such a beautiful program, and so I'm happy to have that there.
That's wonderful. And I'm such an advocate for cultural programming and all of that, because I believe it helps to honor, right, the values of this aina. I hear often, people say, why do we have to connect to like Hawaiian values and all of that? It's because number one, you live in Hawaii,
Right.
and and so when you made this place your home, right? It's like one of the things or the reasons why probably drew you to these islands was the culture and the values of this aina. So why not, right, incorporate incorporate that. And yet we all know that it's also universal values, right? But it's the way we prioritize it that might be different. So one of the things that I do, like I cannot stand when people just want to pull in cultural values or Hawaiian stuff just for the sake of doing it. Oh, we're culturally responsive and culturally appropriate and culturally, you know, all da. Because we have a Hawaiian program, or we call our program with a Hawaiian name. But to really truly understand, right? So making the alignment is really important. So let me ask you, I'm going to play the devil's advocate right now. Okay. So I've heard that some of the domestic violence programs, organizations will not work with someone if they decide to stay with their partner. Is that be a mythbuster if you need to?
Well, you know, actually for Po'ohana na Wahine, we're pillars of women. Okay, so that's the loose definition of who we are. But when we started, the founders, you know, we had many days in talking about what we do. And we actually see women, if you can take care of our women, our wahine, and get them on solid ground again, and help them, you know, provide them with the safety that they need as women, you can actually impact them where they'll affect the entire family. You know, make them solid so that they can also take care of the ohana, because they're over here, they're over there, they're doing this, they're taking care of the kids, they're taking care of the husband, they're doing things that they might not want to do, but they, you know, they're working and they need childcare at the same time. It's like they have so many roles that they do as women. But for us, we never believe that you can only focus on the women. You have to also take care of the whole entire ohana. I mean, that's just foundational, especially for kanaka iwi when you're talking about ohana and oha, right? The kalo, when you brought up the kalo. I mean, you have the main corn, but you have all the oha that's a part of that, you know?
So Dolly, if a woman decided to stay with her abusive partner, you would still work with her?
Well, we're macro. So we're not necessarily doing direct service.
So let me go to Ella.
Yeah.
Yes.
So would you work with a woman who...
Absolutely.
Yeah. Okay.
So we totally understand. I think I mentioned it a little earlier that we understand that some survivors, they don't want to leave their partner. They just want the abuse to stop. And so even though our agency focuses our efforts and our resources on providing services to survivors only, right? We don't work with anyone who has been identified to be the harm doer. We won't, we won't not provide services. We just safety plan a little different. We reach out to them a little differently if it's going to affect their safety, or but no, we won't say no.
Okay.
Yeah.
And can I add
go
to
ahead,
that?
Angie.
So, and I can say that at least our member programs are, you know, I think they're all in alignment with that, and they know, you know, it takes at least 7 tries to leave, and then, you know, when you're leaving, it's the most dangerous time, because you're upending that power and control dynamic, and you know, you're really causing that person who's doing you harm. You're really threatening that balance of power and control, and you're really, you know, so it's the scariest time. But there may be people in the community who are trying to provide domestic violence services, and so on their own, you know, informally, so they may be doing something like that we're not aware of. And so that's why we're always trying to bring and add members to the coalition so that they can be educated and like part of like what best practices are. And we just released minimum service standards for domestic violence programs in the first time in the history of the state. And as part of the membership of the organization, you have to, you know, you have to uphold those standards. And so
let's really talk a little bit about your membership, because you've mentioned it, right? Your membership, like what membership, like joining a club, joining like what, and does it cost money?
Yeah, it costs money. a little bit of money relative to the amount of services that we provide. So last year we changed our membership structure and we added a couple of different structures to it. And so to broaden the support base and those who like are part of like the network to say that, hey, these are people who care about domestic violence services. Our core members are the DVACs of the world. They're the primary purpose domestic violence programs. So they're there, they're doing DV services 365, 24/7, right? Child and Family Service, PACT. But then there are some folks, that are doing, maybe they're only doing visitation services, like YMCA of Hawaii Island. So they're not doing, they actually maybe doing a little safety planning if they have to with a survivor, but they're part of the court ordered visitation exchange, but they're not doing advocacy services, they're not doing emergency shelter. So there are allied programs, but that visitation service is still really important. It can be really dangerous. If our gun laws change, that becomes really dangerous. So it's important for them to be in a network. And then, hey, if there are individuals who want to be part of our world, actually that was a limited. But it changes in terms of like who wants to be part of our network of people who want to be skilled, trained, and are the best supporters of survivors.
So let me ask you, is there shelters on every island?
There are shelters, even Molokai. There's one shelter. Yes.
Great. So we know that there's at least shelters, that there's an option for women. And do we have men's shelters too? Is it?
So we don't have a standalone shelter that I'm aware of, but our shelters, because they receive federal funds, cannot deny somebody who identifies as a male access to the shelter.
Okay.
So if you're a male and you are seeking domestic violence, emergency shelters for domestic violence, you can go to any of our shelters and seek refuge.
Okay.
Yeah.
Now, I want you guys to share a little bit of the statistics that you know of that the community should be aware of. Like, what are some of the statistics? Like, right now, we know that probably Native Hawaiian are on the top, and there's a lot of nuances. There's a lot of reasons for that.
Yeah, absolutely.
You
I
know?
think specifically for DVAC, Native Hawaiians make up the largest ethnic population of survivors that we serve. So I think it was 33% of our overall clients that we serve were Native Hawaiian. And so
And then what next? Because I think.
And then it was Japanese or Filipino. I
have it in my backpack. This is live. I have a lot of data points in my head.
Thank you,
so, but actually, one of the things I want to point out is our homeless data.
No, okay.
From 2023 PICS, Partners in
yes.
Care point in time count. So I'm going to start macro and then get down, okay? So their point in time count, and then so this data since 2018 has been increasing. Now consider that in 2020 and 2021, we COVID. Right? So 23%, so 529 of adults and unaccompanied minors were survivors of domestic violence. So this is a combination so the way HUD defines people who are homeless, if you are fleeing domestic violence, you are considered homeless. So this would be folks who are maybe in their transitional housing shelters, and I didn't want to delve too deeply into the nuance of that data. And so 45% of those DV survivors, so 245 people were chronically homeless. And so in that data, Native Hawaiian Pacific Islanders, and I know this was part of the Missing and Murdered Native Hawaiian Women and Girls Task Force report about why, like some of the limitations of their data was the disaggregation of Native Hawaiians and Pacific Islanders. But even lumped together, they were at 26% of that data. And the next highest were people who identified as multiple races at 36%. So it's the highest in my bag. That full sheet. Sorry, folks.
It's okay.
So it was 36%, but I bet you there are Native Hawaiians who are going to be included in
That's
that
why it's
36%,
important.
right?
Yeah. The
Yeah,
disaggregation of data
yes,
is super
absolutely,
important.
right.
Yeah.
And so why I wanted to talk about that is because even though I know I have all that other data in there as well, but we know from statistically, from Ella's data, from the data from DOH, Native Hawaiians are statistically the highest. They rank highest in the survivors of domestic violence. Our domestic violence fatality review, Native Hawaiians and Filipinos rank as the highest, most prevalent races of those who are victims and their deaths caused by intimate partner violence. And then when we think about this, and I'm talking about now, I want to talk about a little bit about Maui, is I do have that data. So Maui, when we think about from a population, so we saw this data from PIC, which is only the point in time count for Oahu.
PIC is Partners in
Partners
Care.
in Care, which is a continuum of care only for here on Oahu. But when we look at the data from Maui, Maui doesn't have that as high as population, but the prevalence of domestic violence, they are the county with the highest prevalence of domestic violence at 17%. Now, what the fire has done, the fire has left, the last time I looked at the data, there were 7,000 people staying in hotels. And when I think about those people who are in hotels and how many are now experiencing domestic violence, a couple of weeks ago, Sonoi Ka'aihue, who is the executive director of Women Helping Women, was, I think, on KHON talking about the increased number of calls that they're now beginning to see because there is that nexus that people don't want to make the connection with natural disasters and domestic violence. And we're going to really start to see this, and we're already starting to see this, and we're not prepared. We're not prepared for it. And that,
Great point.
And why I'm closing it in on homelessness, because we know that there's already a link between domestic violence and homelessness. The reasons why I don't leave is because I already don't want to. I don't want to be homeless. We have a housing crisis. Now we've had this Maui fire, and I'm calling attention to our legislators. We got to do something about this. We have to be proactive because this is a crisis in the making.
Right. And then when this happened, it impacts the entire family.
Oh, yes.
Not just, the two intimate partners involved, but the children. And we're going to see that influx, right?
For generations. This is going to impact. And Dolly, what are you seeing on the ground? Because you folks have been boots on the ground in Maui for months now, right?
Well, we do have, one of our board members is actually pretty active out there in Lahaina and, responding.
Michelle Navarro, just want to say.
Yes, Michelle Navarro, Ishiki. She's really active. And in fact, she'll be speaking at the next CNHA convention coming up in Maui. If anybody's interested, go check them.
I will. Go check them, go.
Yes. Her, Keola, and Momi Awo, they're the Keola Chan and his Ho'omalu Hui down there in Lahaina. They've been, responding to the culture needs of Kanaka down there. So I haven't been able to really touch base lately, with Michelle, because she's just so actively in there.
Yeah, it's a 7-day-a-week operation, man.
Yeah.
People are volunteering. I know my good friend Mary Akima Lu'uvai is there.
Oh,
and as well as, many others, doctors who are showing up to make sure that they're there to support the community. And as you said, Angie, this is we're looking at a long journey.
We are.
This happening. And we all know that stressors will elevate, right, the amount of incidents that occur. And so thank you for looking into the camera and, speaking to our legislators, because we do have to prepare ourselves. Gone are the days that we wait to the last minute until disaster happens. We need to be more proactive, for sure, right?
Yes.
So mahalo for that. We are coming a little bit to the end of our show, and I feel like you probably have a lot more to share. So
we can talk for days.
we have lots of days, right?
Yeah.
I do want to emphasize, like Hale Kipa, we work with young people, and we opened up our new Ohana Resilience Center.
Awesome.
out in Eva. So we'll be able to work with a lot more families, and hopefully people will do, if you know of any ohana who are experiencing domestic violence or some, stressors to prevent any kind of violence happening in the home, please reach out to Hale Kipa or Ohana Resource Centers, and we will definitely connect our families to these wonderful resources here. I know Angie and Dolly mentioned that they do training. It'd be great if your organization, your staff, your school needs some training around domestic violence. Please reach out to these organizations as well. And of course, DVAC, Domestic Violence Action Center, is there doing hands-on. They're in there working to do groups. And so mahalo to all of you for what you guys are doing. Let's start with you, Ella. You have any last things you want to share?
Yeah, I just want to share that, that for anybody, everybody knows somebody who knows somebody that might be affected by domestic violence, and that you're not alone, that there's people that can help. There's the Domestic Violence Action Center. There's, they can call even the coalition who would direct them to whoever they need, Pohana. And so to please call our helpline. It's 808-531-3771. And, you have people who, I say that we don't need complex tools to do this work. We just need to have an open heart, to listen, to have compassion and love for people, and that's what you'll get on the other end of the line. And so, if you know anyone,
tell the community.
Yeah,
Share,
absolutely.
Share it with them. And, maybe I'm someone who's going through it right now.
Absolutely.
What would you tell he or her?
If you know anyone, if you don't know the words to ask someone that you think might be experiencing domestic violence, call us so we can help you figure out how to have that difficult conversation. But there are people and agencies to help. And like I said, our number to our helpline is 808-531-3771. Or our chat is at www.domesticviolenceactioncenter.org.
All right, mahalo, Ella. How about you, Angie?
So if you want an actual printed guide in 9 other language and ASL for how to respond to domestic violence. So if you have a friend or family who has disclosed to you and you don't know how to respond to that. So we actually have a guide on our website, and it's how to respond to domestic violence disclosure. And it is in those 9 languages, and if you need it for your organization, we have it printed. Like I said, it's in 9 other languages, including Olelo Hawaii, hscadv.org, and I would also plug and say we need to be better prepared when it comes to natural disasters to prevent and respond to gender-based violence, knowing that food, water, and shelter and safety are always paramount, but we cannot forget. And we also need to make an investment and commitment to teaching healthy relationships early on with our children and our community.
Don't you think it should be a requirement for DOE? I think
100%.
healthy relationship courses,
Yes.
parenting classes, financial literacy should
Yes.
all be required courses.
Yes.
Absolutely.
Ask me how many times I use calculus. Okay, but I took it, right?
But
or other things, right?
Learning how to
History, American history.
Yeah.
I'm just kidding.
Yeah.
Anyway, thank you. I agree with you. And Donnie, how about you? Anything you want to share?
I don't know. They don't share everything. How can I share any more than that? No, just, have the conversations, kuka, just like this show is about Kukakuka with the people that's important, to you. Don't be afraid to talk about things, and have these hard discussions with your ohana, or with your friends or whoever you're having this pilina with, right? Because the more we can do these things, the more we can work through anything, really, so it's important, that pilina is totally foundational. And of course, if you need any help from Pohana on our wahine, feel free to reach out to us. We do have a website. We do also have a PSA out there as well. that, we were able to kind of feature some of, at the end of our PSA, we have like who to reach out to for more direct contact, like DVAC, right? So, yeah, I mean, Ohana is important, Community is important as well.
Absolutely.
So, yeah.
And thank you for bringing that up, Dolly, because for us, the reason why we do this show, we take the time to have these conversations, is because it is going to take our entire community, right? That we have to stop being the us and them. It's the we, right? When we see domestic violence, it impacts all of us, right? And when we see homelessness, it impacts all of us. That we have to come together as a community to resolve these problems and keep Hawaii, right?
Yeah.
With we talk about the Aloha State. What does that look like? What does that sound like? What does that feel like?
Yeah.
And so we need to work together. So mahalo for being an example around our domestic violence community, that you're working hand in hand, supporting each other's work. I really, really appreciate that. So once again, these wonderful, beautiful women who are here to advocate for our community and share the resources that they have to share with all of us. Please take advantage of that. And once again, anyone who is watching, I want to reiterate what all of them have said. But like Ella said, we all know someone, right, that have been impacted by domestic violence. So please, no shame, reach out, get the support that you need, and also find out what you can do to support the person if they don't want to come to these services. What can you do? Yeah, be a good neighbor. So, mahalo nui. Really appreciate all of you who joined us in this episode, and we look forward to seeing you again. Aloha.